Hi everybody and welcome to Leeds Dad's AskADad Facebook Live. I'm Erroll Murray from Leeds Dads. We support dads and families to engage with their preschool children. And during these sessions we talk about life under coronavirus, what it is and how families can cope during the current situation. Our focus tonight is what's up with dad? In the week of the International Father's Mental Health Day, we ask, are we talking enough about dad's health? Are we taking care of dad's mental health? And if not, why aren't they caring for themselves? With me tonight is Suzy Hodgson, lecturer in perinatal mental health at Sheffield Hallam University, Thomas Lynch, founder of dad's group Dad's Rock Edinburgh, and Ron Batiste, member of Leeds Dads, who has an experience in the care and legal fields. Can you say hi, everybody, please?
Hi.
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 Thank you. So if you have any questions, please get in touch. Message us on facebook.com/LeedsDads or at Leeds Dads on Twitter. We're broadcasting on both platforms and we'll do our best to answer. Now, coronavirus is a new flu-like virus that's spreading around the world. The virus causes an illness called COVID-19. It's been declared a pandemic by the World Health Organization. That's the part of the United Nations that looks after the health and well-being of people around the world. And pandemic is a disease that's spreading around the world at the same time, all around the globe. What we know is that most people get symptoms of a fever. A lot of these people get a cough or lose sense of smell or taste. Some show no symptoms at all. So how can we prevent catching the virus? It's all about social distancing, or not, according to the news that's come out in the last few hours. Staying 1 to 2 meters away from other people and washing your hands. So our focus tonight is what's up with dad. In the week of the International Father's Mental Health Day, we ask, are we taking enough care of dad's mental health? And if not, why aren't they caring for themselves? Why don't dads reach out for help? With me tonight is Suzy Hodgson, a lecturer in perinatal mental health at Sheffield Hallam University, Thomas Lynch, the founder of Dad's Group, Dad's Rock Edinburgh, Ron Batiste, member of Leeds Dads, who has experience in the care and legal fields. And if you have any questions, please get in touch. Messages on facebook.com/Leeds Dads or contact us on Twitter at Leeds Dads, or you can email leedsdads@gmail.com and we'll do our best to answer. Suzy Hodgson, lecturer in perinatal mental health at Sheffield Hallam. Is it Sheffield Hallam? Have I got that right?
Yeah, it's Sheffield Hallam University. Yeah, I am a lecturer in children's nursing, but I teach into the perinatal mental health with our mental health nurses and our midwifery students, and I focus on fatherhood and father's mental health.
Great. Can you tell us a bit more about your work?
Yeah, so I'm a children's nurse and health visitor by background, and I first started getting interested in father's health, transition to fatherhood, when I was training to be a health visitor. And really since then I've not really put it down, so it's been something that's been of great interest to me. I'm currently in the process of finishing my PhD, which is around the transition to fatherhood, looking at it from a lot of different angles, as it turns out.
Yeah.
And yeah, and yeah, so that started off with an interest in service provision for fathers as they become new fathers, and it's kind of morphed into something that is somewhere between service provision, kind of gendered norms, masculinity, social psychology, so it's quite broad and far-reaching, quite a beast really. So yeah, we started doing some perinatal mental health workshops for our mental health nursing students and midwifery students about 3 years ago, based on some of the outcomes from the Embrace report, and also
from which report, sorry?
The Embrace report, which the particular Embrace report was around perinatal mental health, and it was, our focus was on sort of upskilling our students to feel more comfortable and confident in talking about mental health problems with their service users. And so myself and a couple of colleagues, Tricia and Joe, Joe's a midwife, Tricia's a mental health nurse, and myself, we run some workshops. We've also got perinatal mental health master's programme at Sheffield Hallam as well. So we're really, we've got some really good things going on as far as improving knowledge around perinatal mental health. But certainly my special interest is in fathers and fatherhood.
And we know that mums get perinatal mental health, suffer from perinatal mental health issues, and dads are now being seen to in the same way. Can you give us a few statistics around the impact of that and what perinatal mental health is for those who don't quite understand?
Yeah, so when we're talking about perinatal mental health, we're really looking at the period from conception to, well, depending on who you speak to, really, either 1 or 2 years postnatally. And it can be anything from stress and anxiety or depression prenatally, during pregnancy, and then postnatally. And includes things like puerperal psychosis, which is very rare but a very serious condition that women can experience, through to postnatal depression, which can manifest really any time postnatally. Certainly, as far as statistics are concerned, it depends which research you read, but we're looking at approximately 1 in 10 dads suffering from some form of postnatal depression. As far as kind of depression and anxiety is concerned, the statistics range from about 5 to 15% from conception through to the first year postnatally. But if we think about kind of dad's access to services, maybe that's underreported. So yeah, definitely something that has been considered as far as fatherhood research for quite some time, but I think that maybe our general awareness within society, within our kind of own relationships, perhaps we weren't quite as aware that dads could suffer from these mental health problems in their transition to fatherhood. I mean, I think from yesterday's experience of International Father's Mental Health Day, I was really enthused by the fact that there was a lot of talk of this. There's a lot of research going on, and there's a lot of people doing some really fantastic work. I think probably what we need is a bit more of a joined up approach, and maybe some policy that actually starts to consider father's mental health as being as important as mum's mental health.
That sounds very fair. I don't think that the powers that be recognise the issues that affect dads in the same way that they recognise the issues that affect mums, but we'll come to that a little later. With the impact of coronavirus on society at the moment, do you think it's had an impact on dad's mental health over this last few months?
Yeah, I mean, for sure. I think it's had an impact on all of our mental health, hasn't it? Certainly, there's been some reports out about the increase in childcare that dads are undertaking during the pandemic, working from home, trying to juggle families, trying to juggle working life at home, as mums are as well. Mm-hmm. I think one of the things that I'm a bit worried about, or quite worried about, is the decision to I guess restrict fathers and partners from antenatal appointments and in some cases from births. And that's been kind of a varied response across the country. And obviously, you know, these decisions aren't made lightly, and, you know, whatever your feelings are about them, what I'm worried about really is that what we know is that when dads attend births, when they go through that experience, it's the formation of their family. It's where they start to feel like for some of them it starts in pregnancy, but for some men, that sense of becoming a father starts at birth, and not being present and not going through that process. potentially for some men is going to be significant as far as their mental health is concerned. And I think probably that is something that we really need to be very mindful of. We know that men have varied experiences during birth. We know that women have varied experiences during birth, which can contribute to postnatal mental health problems. I think that lack of access and that inability to be there is going to be something that could have, consequences for months, years. And so from a kind of service provision point of view, but also from a society point of view, from looking after one another, from thinking about new fathers, just, family members, friends, people that just thinking about, what it might have been like to become parents for the first time during this pandemic. And for women
we've got, as well. I beg your pardon?
I was just going to say, for women giving birth, well, not on their own, but with midwifery support, but without their partner present, for them as well.
Leeds Dads has had 3 new dads over the last 2 months, and it has been. They've made it clear that it has been a challenge for them. The specifics are that you can only go in to the maternity suite with your partner. Otherwise, you're not even allowed into the hospital. And once the baby's born, you're literally out. And the mother has to leave within 24 hours as well, which is a real challenge for the couple themselves. And it's clearly going to have an impact on their well-being. That I think we had 4 days in hospital because there were a couple of complications, and we came out absolutely shell-shocked.
Yep.
So the idea of a new dad and a new mum coming out after 24 hours with a baby and a number for midwife support, it's like, how do people react to that? But go ahead, sorry.
Yeah, I was just going to say, in addition to that, the normal family support that they might have has not been available either, because of social distancing, because of people isolating, etc. So yeah, we've got kind of a very, very quick transition to parenthood for these new families, in addition to perhaps lacking that village around them, or that kind of family and friends support, because we've not been allowed to do that.
Our focus tonight on Leeds Dad's AskADad Facebook Live is What's Up with Dad? In the week of the International Father's Mental Health Day, we're asking, are we taking enough care of Dad's mental health? And if not, why not? Why don't dads reach out for help themselves? With me tonight is Suzy Hodgson, a lecturer in children's health. Is that correct?
Children's nursing and public health.
Children's nursing and public health. Well, public health is a big enough issue itself. At Sheffield, Hallam University, and Thomas Lynch, the founder of Dad's group, Dad's Rock Edinburgh, and also Ron Batiste, a member of Leeds Dads, who has experience in the care and legal field. So if you have any questions, please get in touch. Message us on facebook.com/Leeds Dads, or at Leeds Dads on Twitter, or you can email us leedsdads@gmail.com, and we'll do our best to answer. Thomas Lynch, founder of Dad's group, Dad's Rock Edinburgh. How are you doing?
I'm good, Errol, thanks. This is like being on a radio show, isn't it? You're doing a good job.
It's radio on the telly, but it's not even on the telly. You've got to remember, we've got a generation of people who don't watch TV. They watch screens like computers and phones. So it's not going to really put them off in any way. It's crazy. How was Father's Day for you?
It was good. It was busy. Yeah, we still had our online Zoom event for families. So that was good and busy and different for everybody this year.
Well, we were meant to have our Father's Day event on Father's Day on Sunday, and as you can imagine, not being able to be in touch with people makes it very, very different. But can you tell us a little bit more about Dad's Rock?
Yes, so Dad's Rock started 8 years ago. Me and another dad, we were just talking one night about the lack of stuff around in Edinburgh for dads. and wondering where all the dads were. We had toddlers. I used to take my toddler to a group, and there weren't any other dads there, and I used to wonder where they all were. So I was introduced to this other dad, David, and we were talking one night, and we said, let's just start a playgroup for dads, and it kind of all snowballed from there. So that was 8 years ago. We just did playgroups, but then a couple of years afterwards, we became a charity, and we kind of looked around at what else wasn't around for dads, and what wasn't available. So right now, during COVID, what we're doing is we're still doing our workshops. So we've expanded our parenting workshops. We run antenatal for dads, antenatal for mums. We do first aid, feeding, sleeping, hairstyle workshops. So we're just trying to offer different workshops for parents.
That's 4 workshops, I think.
Yeah, obviously at different times, Erroll.
That's plenty.
So we're just trying to offer different workshops. We're doing a parenting course as well, a 6-week parenting course, and we're running that for dads at the moment. So we're doing the workshops at the moment. We're still supporting young dads. We have a project in Edinburgh where we support vulnerable young dads, and we're still providing music tuition. So, what started between 2 dads 8 years ago, we now have 11 members of staff, including myself. So there's a lot to be done. We've actually just applied for some perinatal funding. Whether we'll get it, we'll see. But if we are successful, it's quite an exciting project for dads, because there's lots of gaps. There's some really good projects in Scotland for mums, some befriending projects for mums for a perinatal point of view, but there's very little for dads. So I think there's still a lot that can be done, and there's a lot that needs to be done. And it's nice to see people like yourselves and other people, stepping up and wanting to do exactly. People like Leeds dads.
Well, we try. You should flash your shirt at us, though, just to make sure that
Good
everyone.
idea, isn't it? Having your name on your T-shirt.
I know. I've got this idea of you can imagine 2 guys sort of like drinking heavily one night and saying, look, let's do this, and say, yeah, it's a great idea. And the other side of it is 2 dads exhausted, probably in a similar mental health state of address, and saying, yeah, why don't we do this? Why don't we start a dad's group? And it's basically the same impact. Is that what it was like?
Sorry, were you insinuating a cultural stereotype there, Erroll, by saying Scottish people drinking?
No, I'm talking about tired dads and people saying, let's go and start a rock band. You're picking up things here. That's you.
Yeah, I think we didn't really have an idea of what we were doing 8 years ago. We just knew that we wanted to do something, and we couldn't see a lot of support for dads. And we just felt like we had to do something, and the time was right to do something. And I'm sure a lot of what happened was luck and just being in the right place at the right time, and making contact with people. And it's not an original idea to have a group for dads. Lots of people have done it over the years, and lots of people have stopped doing it because it can be hard to engage dads and to bring dads in. And it can be quite disheartening when you've tried something and you really want to do something and you're not getting the numbers that you're expecting. But I think it's very complex as to why some dads don't want to join groups and why some dads feel uncomfortable coming into groups. So I think we've just got to continue to do things to try and make it feel normal.
Interestingly, what's Mark Williams, the man behind the International Father's Mental Health Day. He told me that he started doing this 10, 12 years ago, and was known then as a mental health campaigner, and it wasn't actually seen as a dad's mental health campaign. And now it's all about supporting dad's mental health. So things do change. We do recognise that things do change. So who's looking out for dads, Thomas? Who do you think is looking out for dad's mental health? And what are the issues?
I think that I'm not sure that many people are. There's some great projects in Scotland. There's one called the Changing Rooms, which is based in a couple of football stadiums. So it's a mental health charity called Sam H, and the football clubs have come together, and they've got a really great project specifically for men, and that's doing really well. And then we also have to look at Andy's Man Club across the whole of the UK. You know, that's just come out of nowhere, and that's been brilliant. And that's really grown from the grassroots, and they've had some fantastic numbers. So I guess, you know, we've got to be honest and say that they're definitely looking out for men's mental health. And I'm sure there's lots of pockets of projects around the UK who are looking out for men's mental health. But I don't think, as Suzy said earlier, there's not a lot of joined up thinking. There's not a lot of chat about it unless you kind of force the issue. So I think there's a lot more that could be done.
Is it that big an issue? Does it need so much support? Why should we make a noise about it?
Because 75% of all suicides are male. Because thousands of men take their life every year, kill themselves. Because 84 men die every week because of suicide. You know, I think that's a scandal. It's a tragedy in the UK. And mental health's really tricky, right? Mental health's really sticky because it's not like fixing a broken hand, or it's not like something that's obvious. So mental health's always been a bit tricky, and it's never been seen as sexy. You know, you look at all the money that's raised for cancer research, rightly so, because cancer is obviously horrible and kills lots of people. But you know, there's been a lot of good campaigns being done about cancer and how to highlight that issue and how to throw money at it. And I think we're hopefully starting to see the same thing happening with mental health and with male mental health. I think when we see celebs and when we see royal family and when we see other people talking about it, it all helps, doesn't it? But we need to see the money.
Very true. Suzy, men aged 45 to 49 are the most likely to commit suicide, Samaritans say. And also, men are half as likely to visit their GP, half as likely as women to visit their GP. That's more of an international report the US Centre of Disease Control and Prevention has found. Do you think that dads don't want to take care of themselves, or do you think they get overwhelmed, or it gets overlooked? What are the issues? They're not going to the doctors.
No, I mean, it's a really big question, isn't it? I mean, there's a lot of schools of thought about it, whether it's around kind of our perceptions of masculinity and what men should be like, how men should act, what they should do, what they shouldn't do. I think one of the things that, you know, I know Mark campaigns tirelessly for men to be screened postnatally, which is fantastic, and I completely agree with it. But we also need somewhere for them to go if they screen as high risk for postnatal depression. And I think we also need to be receptive. So it's not just about saying men should talk, it's about us providing services where that are, you know, male focused, that we are trained to speak to men, that we are providing the service that meets their needs.
So you're talking about two specific things there. One was men need somewhere to go, or dads, shall we say, need somewhere to go if they're at high risk of depression. What was the other point?
Well, what I mean is that, so the first one is that, you know, if we are screening, then we ethically have an obligation to provide a service to meet their needs. So if you're going to screen someone for something, you need to then have a referral pathway. Otherwise, you know, we're just going, you're really high risk, kind of, we don't know what to do with you. So certainly, I think, you know, NHS, the long-term plan for the NHS has brought in some support for men for partners of women who are involved in perinatal mental health services. That work is developing at the moment. I know across the country, some Some services have already started to see partners of women who are engaged with perinatal mental health services. Others are developing that at the moment. So that's one step forward, but it's only for partners of women who are already engaged in those services. The other point that I said was that, you know, we need to have services that are going to listen, that are going to understand that this can be a problem for men as they become fathers, either for the first time or the second time or the third time. And I think awareness as far as kind of fathers' mental health problems, perhaps we because we are in this sphere, maybe we overestimate people's knowledge and awareness of it. And I think just generally, we need to raise more awareness. We need to, as I was saying before, you know, as partners, as family members, as friends, we need to kind of, you know, be more aware of those mental health problems that fathers can experience and not minimize them. You know, the sort of discourse around, well, what have you got to be depressed about? You've not had a baby. That kind of stuff is really unhelpful, and is also misinformed. So not only do we need the referral pathways, we also need the receptivity of services to fathers.
Yeah, I mean, just listening to you, Suzanne, there was an awful, you've said an awful lot there that is so relevant and just highlights the issue of the complexities around mental health for dads. But I couldn't help kind of like think in terms of the nature of my work over the years, where, you know, I have worked with in the field of mental health and in the criminal justice system as well. And I think as well, if you look at the criminal justice system, if you're dealing with the mental health of men generally, they're either pushed into prisons or secure mental health units, you know, from the criminal aspect, you see. And that can have a real big knock-on impact in terms of young men getting into trouble with the law, you know, in terms of their mental health, and then they eventually become a father, and then all the high risk elements that are attached to them in terms of them having a mental illness, being a risk, being a danger. A lot of that is played out in society. In terms of a man having a mental health, they are less likely to be shown much pity, as it were, and there's this culture of dangerousness that surrounds men with mental health. But whilst you were saying that, as we're going along, there's various questions coming in, and I've noticed somebody called Amy Jenkins has she's asked about, I think it's about 2 or 3 questions, and I think it might be relevant for, I think, Thomas and Suzanne, both of you, to take your pick which one you're going to answer, I think. I'm going to read out the first one. She says, thanks for doing this. I wonder how dads not being able to stay with mums much around or after the birth during COVID-19 might affect everyone's mental health. So I suppose you touched on that a bit, but maybe just a little bit more specifically, if there's anything yourself or Thomas could mention about that.
Do you want me to go first, Thomas?
Yes, go. Oh, sorry.
Thank you, Amy Jenkins. She's one of the service managers that I work closely with. So
right.
Yeah, I mean, as I said before, there's a lot of research around men's experiences of birth, positive and challenging, but certainly for men who perhaps can't quite perceive their baby during pregnancy, which is fairly common. They're not pregnant themselves, they can't feel that growing inside them. The birth can be that moment where it all becomes real, and it is that sort of almost transformational moment for them. They become a family, they become, you know, to not quote the Spice Girls, but 2 become 3. No, it was 2 become 1 there anyway, wasn't it? But anyway, you get my point. So it's a point of transition, and family formation, and so missing out on that you know, yeah, some men will cope, and some men will manage fine, and some men are just happy to get home and just relishing being a parent and being a father and just getting on with it. Others won't. And so it's those that we really need to be mindful of. And I think that you know, there are challenges around bonding and attachment. If that birth hasn't been as straightforward as perhaps they hoped it would be, if there are, you know, if there'd been any challenges, and then they are going home quite quickly afterwards, if everybody's kind of medically well, they're sitting there with those thoughts, they're sitting there with that experience, and so, you know, that's normally, you know, and not being able to be there, I think they, you know, they're not experiencing necessarily that trauma of being witness to any complications, but they're also missing out on that transformational experience. So I think that is something definitely that we need to be really mindful of as we move forward. I think there could be something there around that relationship as well, and you know, I don't know what that might be. I don't know how mums are going to feel about dads not having been there, dads feeling some form of being left out by not being there, or, you know, some interruption to that transition. But certainly I don't think it's going to be nothing.
Right.
Yeah.
And Thomas, did you have anything to add in terms of about the question, or any comments on that?
I guess the sort of optimism, and the optimist in me hopes that actually, because of lockdown and because of people being restricted with their movement, that the early days of being home might help and might be of benefit to dads if they felt like they've lost out at the birthing stage. We interviewed a dad whose wife gave birth during lockdown, and you know, from his experience, he didn't feel it was hugely different from what he would have expected prior to lockdown anyway. But that's just one guy, and as we know, labour and birth are very individual, and everyone is very different. So I guess it's the people that we don't see, isn't it? That's the worry, the people that we don't already engage with. You know, as I said, we do antenatal classes for dads. So we're speaking to dads before they're going to have the baby. We're able to talk to them about things, and we're able to talk to them about support, and to keep in touch with them. But it's all the people who don't come to antenatal classes. I've spoken to quite a few parents, and they've told us that they're doing lots of different antenatal classes because they're all online, and some of them are charging, some of them are free, ours are free. But you know, parents are doing multiple classes now, which is good, that they're trying to get as prepared as possible. And also, a dad was telling me that when his wife was in hospital, and he wasn't allowed in, he said that she found hospital really noisy because everybody was on FaceTime and everybody was on their phones because they were on the phone talking to the partner. So it was quite a noisy environment and didn't feel as relaxed as perhaps prior to COVID. So I think it's really complex, and there's lots of different, it's going to be really personal. But it's, I guess, to me, it's the people that we're not seeing. You just hope, I guess, that the NHS professionals pick up on it and are able to signpost people.
Yeah, just want to move on to another question here from Nayan. I don't know who'd be best to answer this. I think both of you again. How does dad or their partner, stroke family or friends, identify that their mental health actually needs looking at? What are the signs to look for, triggers, behaviours, etc.? That's from Nayan. Yeah, if you want to go first again, Suzanne.
Yeah, I mean, I think again, it's quite individual, but I think there are warning signs around kind of sort of interactions as far as relationships are concerned, maybe withdrawing from relationships. Certainly in the literature, there's sort of some behaviours around maybe throwing yourself more into work. Although in the lockdown, if we're all working from home, that, you know, that could be different. Using substances to cope, so alcohol, other substances. and just kind of, I guess, withdrawing a bit from those kind of close relationships, not necessarily engaging so much with baby, perhaps not having those positive interactions with baby. Certainly with mums, you know, again, there's loads and loads of different presentations, and so you might see things like mums putting on a mask and looking like they're coping really well, and
Yeah.
presenting as looking, oh, you know, they don't look depressed. But mums are really good at hiding that and masking that, and they will take really good care of their babies, but they will go through the motions.
Yeah, and it's so difficult, especially where you've mentioned about substance misuse, and that's such a huge area, substance misuse and mental health. You know, how can you tell what becomes recreational use to more chronic substance misuse linked to a mental illness? You know, when you start going into the realms of drug-induced psychoses and all this sort of stuff, you know, it's a sharper end of the spectrum. But I suppose in terms of people concerned about their partners, how do you pick up the early signs? It can be really, really difficult to identify those early signs.
Yeah.
I don't know, Thomas, if you had anything to add to that.
I think Suzanne's done a really good job of summarising some of the presentation.
Yeah.
I would agree with the whole withdrawing, and maybe, again, it's a generalisation, but maybe finding it hard to do things. And something that I always say to dads especially is that I guess you're looking for somebody's mood to change and to stay down and to be down and not to come back up, because, you know, baby blues is a thing that can happen and people bounce back from that. But, you know, for depression and for serious depression, it's something that goes down and doesn't come back up. And if you've been with your partner a little while, you should hopefully have a bit of a feel as to what you would normally expect. And although, as we know, hormones and emotions can be a bit all over the place in pregnancy for mums and for dads, you wouldn't expect a person to be down and to stay down and to find it difficult to cope. So I think that those are the sorts of signs, and we would always recommend people speak to health professionals.
Absolutely. Yeah.
So interestingly, been talking to a couple of our dads lately, and 2 or 3 months ago, they told me that alcohol was the problem, and now they're telling me that alcohol is the solution, and it's how they're managing through the coronavirus, and also how they're coping with the increased discomfort with being in being locked down, and the impact this is going to have on so many people's mental health. It must be staggering already.
Yeah, just wanted to mention the other 2 questions by Amy Jenkins. She says, what could employers do to help dads more with their mental health around the time of becoming a dad? And then she's asked again, I believe the question she's asking is, what works actually to engage dads with all the challenges that they face? I think with the first one, I mean, I'd like to make a quick comment on that, and I'm just talking from personal experience, really, that, and also generally, I think everyone here, Erroll, Suzanne, and Thomas would agree that nowadays, I mean, years ago, paternity leave was unheard of for dads. You know, when a new baby was going to be born, dads were expected to continue working. A lot of the services were there for mums. But now, during these times, I suppose within the past 5 to 10 years, and what I've noticed from experience as well, that employers can be quite generous in giving fathers time off, maybe 3-4 weeks time off on full pay, to actually spend time as paternity leave. I know it's not the same as what mums has. I mean, in other countries, I believe in Scandinavia, that a lot of the paternity leave is equal, and it's also interchangeable, I believe, in places like Finland and Sweden. But as well, yeah, lots of employers are pretty good at, you know, giving generous paternity leave to fathers. Yes, it's a step in the right direction, and some actual employers actually offer mental health services where you can speak to a counsellor over the phone and things like that. So, you know, it's moving in the right direction, I would say. And I don't know if Thomas or Suzanne wanted to answer. I think I'll put this one to Thomas in terms of what works to engage dads in your experience when they're actually working with them.
I think you need to use the word dads. I think, you know, it sounds really simple, right? But
yeah,
there's been so many services who've asked us to look at what they do or to help them, and they don't use the word father. They don't use the word dad. They don't look like they have designed services for men.
yes,
they don't have men on their websites. So I think in some respects, it's quite simply making sure that you're very upfront to say this is for men, and this is for men to engage with, and this is for men to be part of, and making that very obvious, very clear, and just trying things out. And that can be scary to do if you're using funding and somebody else's money. But you know, we need to try things still. We need to continue to fail in the hope that some of our failures lead us to a success. You know, we've done lots of things over the last 8 years, and not all of them have been successful at all. And we've been quite fortunate that we've been able to take some chances. For example, our Young Dads work, where we support young dads one-to-one, we've been doing that for like 5 years, but that's taken about 5 years to speak to professionals and to engage with them in the right way and to do it. So I think the short answer is just use the word dad, man, father, use that a lot. And if I'm being honest as well, you know, mums have always been great supporters of the work that we do. You know, we know that, for example, on Facebook, 70% of our followers are mums. On our website, 70% of our users are mums. So don't underestimate the ability of mums who get it and who want to help and who can recognise that there's something that their other half should be involved in. So I think, you know, it is looking at the whole family as well. Yes.
Yeah. Can I just say a couple of things? I completely agree with you, Thomas. I think the thing that sometimes when I'm speaking about some of this stuff and my research, I have to make it really clear that this is about the whole family. If we can get things right for dads, it has benefits to the whole family, has benefits to moms, it has benefits to children, it has benefits to children's long-term development. So it's really important. I want to go back to the leave thing, if the workplace.
Sorry, does that mean that you don't think people see the value of supporting dads in the same way as supporting mums?
I don't think they do necessarily, or I don't think everybody does. I don't think enough people do. I think there's some people that absolutely get this and understand it. I think that, you know, it's a bit of a challenge when you're talking about things like pregnancy and maternity and labour and birth, and, you know, absolutely this is women's bodies, absolutely, you know, we get that, but dads really want to help, dads really want to be there, partners really want to be there, mums want dads and partners to be there, and we know that as a holistic approach, as a family-centred approach, can only have benefits for everybody involved. As far as the workplace thing's concerned, Ron, I think 4 weeks paid paternity leave sounds like an absolute luxury to lots of men, and certainly a lot of the men that I've spoken to have had 2 weeks. I think small businesses would really struggle even with the 2 weeks paternity leave. I would love to see more workplace support for new fathers, because after 2 weeks of paternity leave, if they get that, they're back at work, knackered, having just gone through this monumental life change, while still being expected to perform and you know, to you know, do all the things that they usually do, and you know, workplace and paternity leave and returning to work was a massive part of what my participants in my study shared with me, that it was just too soon for a lot of
Yes.
them. It was just absolutely exhausting.
Yeah.
They didn't want to leave their babies. They did not want to leave their partners. They were worried constantly about how
Yeah.
their partners were coping. And I think
Suzy,
something workplace would be phenomenal.
Suzy, one of your reports had an interesting title regarding this.
Yeah, well, it wasn't. It was just one of the. Do you mean the crying on the bus? Yeah, it was actually just a quote from one of my participants that I put on for International Fathers Mental Health Day, because you know, and I think when we discussed it, Erroll, you know, you were just kind of like, wow, that's really powerful. And when I was doing the interview, I was kind of stunned, really. So it was one of my participants, one of my fathers that I spoke to, who told me that on his first day back, on his way to work, he cried on the bus. And, you know, even now saying that, without being sentimental, it sends shivers down my spine, because that's, you know, what an experience to go through, to feel like you are so sad to go back to work, to leave your family, to, you know, be in this position. And just going back to Sweden and Finland, yes, they do have much more paternity leave, but actually they don't have great uptake of that paternity leave. And so that lends the idea that there's more at play as far as taking paternity leave.
Right.
Alex Wilson has put a question forward, saying employers and government should give significantly more paternity leave. Shared parental isn't the answer. Is shared parental the answer, Thomas? Because we've heard about the sort of Swedish, the Norwegian models.
Shared parental leave is not the answer to anything. It's a crap system that, let's be honest, I don't think anybody wanted, but it was clearly a compromise. I know a lot of families have used it, and you know, we'll support families and help families to use it. And there was one dad who spoke to me to say that he had to print the legislation off because his employer didn't believe it was a real thing. He thought he was making it up. He had to take it into his employer, and his employer couldn't believe this was real when he saw it. So I think shared parental leave is a step in the right direction. But
why are you dismissing it?
Because, you know, a dad said to me recently, he said, so I have to steal some of my wife's leave in order to get more leave. So I need to take some off her. And he didn't feel that that was fair at all. So yeah, I'm not dismissing it. I think it's just a broken system that needs a lot of help and needs to be changed. And I personally think it should just be standard that men have X number of months off when the baby's born, and that's just it.
Suzy, how do you see this?
Yeah, I agree. I agree with Thomas. I think that there was a lot of talk about this in my research, where again men felt that they were stealing it from their partners, or it wasn't. Sometimes it wasn't even a discussion as far as sharing that leave. Yeah, I mean, if you look at the rates in places like Sweden of men taking up that leave, it is improving slightly, but there are still kind of social barriers to that, as far as you know, earning money, but also the perception of men in the workplace as not being as committed to work if they take leave. You know, why would you want to be at home looking after your child? Those kinds of feelings are in the literature around paternity leave. So there's something else that needs to happen, which is about how we perceive dads and how we perceive caring and how we value that. And we aren't going to have equity. We're not going to have equality unless we, like, you know, have equality. You know, if parental leave isn't equal, then we're never going to move forward with things like the gender pay gap and that kind of thing. So so there's way more to it than just providing that leave. But I agree with Thomas, it's you know, second rate.
But as well, I just wanted to throw something in there. People would argue, well, how can we actually afford all of this? You know, who's going to pay for it? Can we afford it? How is it going to work? So there's all those issues there as well. That you know, I agree with all this paternity leave. I mean, I've benefited from paternity leave with my children because I work in a large organization that can perhaps absorb the costs of those, you know, of paternity leave. But overall, I mean, so many small businesses, how are they going to work with that, you see?
Yeah, it's a good question.
Yeah.
Kieran from Dads Matters, another dads group over in Manchester, says, what do you think about having commissioned services in perinatal mental health, specifically for dads, commissioned by CCGs with a focus on attachment? What would be the benefits of that, Thomas?
Oh, you're using a few sort of English acronyms there.
Well, I guess you don't have this. You have similar structures to us, but obviously not quite the same.
What's the CCG?
That's the commissioning group, which is basically the money that goes to the GP networks. I guess it works slightly differently in Scotland.
So is Kieran saying? Is Kieran asking?
Give money to the CCGs, which is the GP networks, the GP hubs, and commission services from there to support perinatal mental health issues.
I think that sounds like a brilliant idea. I think, you know, to kind of answer Ron's question as well about can we afford it? We can afford anything if we want it. We've got magic money trees for things, for things when we want it. You know, we talk about having no money, but I would also say, you know, can we afford to not do this and look at the impact that this is having? And we know that the impact this is having on families. So I would argue that we can't afford to not do this. We can't afford to leave it as it is. I think to answer Kieran's question, I think that sounds like a great way to go. Again, I don't know how it works in different areas, but if GPs are kind of closer to the issue, closer to the ground, and therefore able to be closer to the community, then that sounds like a really good way to go. And again, I would ask, you know, if we've got those, if we're commissioning services for mums, why are we not commissioning services for dads and partners?
Suzy.
Yeah, I agree. I think that there is enough evidence to justify this now. I don't think that we can argue that there isn't enough knowledge or evidence base now. Certainly research needs to carry on, but I think that there is enough there to say, yes, this needs to be done. And just, you know, I mean, I do work quite closely with our local perinatal mental health service, and they would love to do this. But they need the money to do this. They need to be commissioned to do this. That's how it works. Where they can, they provide as much support as possible. And certainly with the NHS long-term plan supporting the partners of women within perinatal mental health services, it's a step forward. But yeah, the money has to come from, you know, it has to be there. But I don't think that we can make the argument that there isn't enough evidence anymore, because there is.
So we saw a change. Sorry, Ron. We saw a change about 2 years ago at the end of 2018, where money was made available for supporting dads in perinatal mental health issues, regarding perinatal mental health issues. The door's open, isn't it? The recognition is there.
Well, the recognition's there, but they aren't commissioned services at the moment. So that I think what you're referring to is the offer that is for partners and fathers of women involved in perinatal mental health services who are already within those services. This isn't something that is generally available to dads. So if a dad goes to a GP, for example, at the moment and meets the threshold or wants referral, they'd probably go through to IAPT. And that's probably the service that they would get unless they warranted specialist mental health services. but they wouldn't get those as a dad. They'd get those as a someone requiring mental health services.
Yeah.
And the same with IAPT. I mean, I've spoken to our local IAPT providers, and again, they would be seen as someone in distress, or someone with depression, or someone with anxiety, but not necessarily a father with presenting that way related to fatherhood, for example. So there are steps, there are things happening, but slowly.
Yeah, just want to jump in there a second. So, in response to what Thomas has said earlier on about can we afford this, and I totally agree with you, Thomas, that we have to do this. I mean, in terms of what you're saying, Suzanne, as well, the evidence-based, we can't not do this. I mean, I'm picking up here that this is a sort of an approach in terms of social change. We want to not only improve the mental health of dads, as you've mentioned as well, Suzanne, the knock-on effects for mothers, the knock-on effects for children as well, in terms of, children who come from homes where there's minimal mental health, they're not affected by mental illness. Parents, those are one of the risk factors in terms of social, in terms of affecting their social mobility, I can't remember the word now that I was going to say, but in terms of them doing well at school and going on to leading successful lives. And it's just, we've had another, it's a comment from Amy where she says, all of us who grew up without their dads around know how key parental relationships are to dads being healthy, involved parents, because children often stay with mum when parents separate, which must impact on dad's mental health, at least for some. It feels like relationship therapy is something like GPs would be so popular for new parents and might normalize distress in both parents. You see, it's a very pertinent comment. Is there anything you wanted to say to that, or add to that, Suzanne?
Yeah, I mean, I think one of the things that we do need to do better is prepare people for relationship changes and having realistic expectations about what it's like to be a parent. And I think we need to probably do better from an antenatal perspective. I mean, I don't know, Thomas, whether you include that in your antenatal provision, but instead of just focusing on labour and birth, which obviously is really important, but it is in the grand scheme of things, it's a very short amount of time compared to parenthood. And I think if we can normalise, the challenges of becoming parents, the challenges of sleepless nights, and not having time as a couple, not having time to talk about anything other than babies and feeding and all that kind of thing. If we can bring that out in the open and just say that isn't supposed to be all kind of look at the wonderful cupcakes I've baked today kind of thing. Actually, it's really, really hard and really, really challenging, and that's okay, and it's supposed to be. Then we can kind of just bring some of this stuff out in the open, as opposed to kind of, I guess, a lot of the pretending that everything's fine and it's supposed to be fine.
I agree.
Okay.
I agree.
Yeah.
What do you agree with, Thomas?
Everything Susanna said.
Well, yes, but we're all working in the support field for dads, and we want dads to be sort of engaged. There's a lot of sense being said there regarding, the support is there for mums, so it's ridiculous to overlook dads. There's a lot of support amongst all of us, for the point saying, it's ridiculous to take leave from mums. We should work it the other way around and add to dads, because there's so many ways where it pays off. A happy home makes a child more better behaved. A dad that's active in a child's life makes a child more better behaved, gives more better outcomes in life, leads to the mum possibly breastfeeding, possibly going back into education or work. So the wins are all around. But
Yeah.
why isn't this happening? What is
I,
the problem?
I was just going to add, Errol, that I don't think it's not like it's sorted for mums though. I think it's really patchy for mums as well across the whole of the country. I think there's some great pockets, but there's also some really poor support. There's a thing in Scotland called mother and baby units. So
Yeah.
in hospitals, they have mother and baby units. My understanding is there's like single figures of beds across Scotland for mums to go into a mother and baby unit. There's and Scotland geographically is quite spread out. So that's just one tiny issue, which is a huge issue, that there's not enough mother and baby unit beds. So I think there's still a lot more that needs to be done for mums to support them through perinatal mental health.
I work in the perinatal health field in Leeds, and there's less than 10 beds in Leeds. And if there's more beds needed, then families locally would have to go to. I think there's an MBU in Sheffield, up in Teesside, and then it's over in Lancashire. So the challenge stays across the board, and it is a challenge. We're literally running out of time, and we're almost out of time. We should have ended 2 minutes ago. We'll run on for 2 more minutes. 4 reasons dads don't talk about mental health. Just give me quick bullet point responses for each of you, please. 1, we don't want to make a fuss. Suzanne.
Well, will anyone listen?
Oh, okay, Thomas.
We're not as important. We've got to focus on the kids. We've got to focus on mum. So we're all right.
2, male conversations don't really go there. Should we talk about football instead, Suzanne?
Well, it's quite interesting because I think Erroll and I had a bit of a chat about this earlier, and I think my experience of inviting men to participate in my research is that they sat down and they didn't stop talking. So given the forum and given the space and the opportunity, then I think that is a myth.
I really agree with you on that one because my background is in social work, and I've worked in many in terms of various institutions, and done a lot of work with men, families, everything else. And men do talk as long as you create the right environment. And I found in my experience that men will talk one-to-one, group sessions. It's how you connect, and I think that's really, really important. You see, and I don't believe that men talk to me necessarily because I'm a man. I have seen colleagues who are female who are absolutely brilliant at engaging men in getting them to speak as well. So yeah,
it's being available to them, I think.
Yeah.
Number 3. Sorry, we're short.
Go on.
On time.
Yeah,
Number
shorter
3,
time. Yeah.
We're not really sure where to start. Thomas, this is what the dads say, or this is what people think dads say.
But I wouldn't say that's in my experience that men don't know where to start. I think they generally do find a starting point, and even if the conversation is generally light and about football, it can quite quickly descend into something else as well. So I wouldn't agree with that statement personally.
Number 4, I'll get you all 3 of you on this. We still think having a dad's mental health issue is weak. Suzanne?
Well, firstly, I think that's just really sad. But also, I think that I think that this isn't just a health service or a social service or a third sector organisation shift. I think this is something of a social shift in our thinking about men and women and masculinity and caring and all of those sorts of things. So I think we should all be taking responsibility for this and things like changing language, which I feel quite passionately about, minimizing men's health in general. So yeah, that's I'll shut up.
Explain changing language, please.
Okay, so I think that whilst ever we're using things like man flu, man up, grow some balls, and those kinds of things, we are just feeding into that kind of hegemonic masculinity about, men don't have feelings, men shouldn't express emotions, men aren't carers, men should be out at work and earning the money and all that kind of stuff. So I think we use a lot of flippant language in our daily lives that actually ends up minimizing men's health in general, and that therefore impacts on men's mental health.
Thomas, we still think having a dad's mental health issue is weak.
I think there will be people who use that word and who believe that for a long time. I think it is a big shift. I've been quite inspired by, if I'm being honest, a lot of the younger generation. I've seen a lot of younger guys being really open and really frank, and don't get me wrong, older guys as well. But it's really inspiring, I think, to see young teenagers and 20-somethings being quite open and putting it online and sharing it and being quite happy to do that. And I think that's a great thing. And, that would never have happened in my day when I was growing up. So I think that,
Were you allowed to have feelings in your house? We weren't allowed to have feelings. Did you have feelings?
We had angry and sad. Maybe happy.
We had nothing more than that.
So yeah, I think it's going to take time, but I think it's slow steps, isn't it?
Ron.
Yeah, I mean, just listening to the two comments, I couldn't help in my head that by mentioning that, it's like you're telling dads to shut up, or men in general to shut up. You're not important. You know what I mean? And then, it plays into this kind of self-fulfilling prophecy, as it were, where if you're being told to shut up or you're being dismissed all the time, you then start to act like how people perceive you to be.
That's an awful thing to hear.
Yeah.
I think we'll have to leave that one there.
Can we leave on a positive note?
No.
Well, no, we will leave on a positive.
Yeah.
I'd like, from each of you, can you give me 3 points that will support good mental health for dads from an individual's level and also from an organisational level, from a body, from the government, from the CCGs? What would you who funds the NHS in Scotland at sort of local levels, Thomas?
I think there are similar groups, but they've got a bigger acronym.
Well, that's what happens when you cross the border, of course. So yeah, 3 things that would support good mental health for dads as individuals and also from an organisational level. Thomas, you're on the spot, please.
3 things, geez. I think that just visibility. I think things like tonight. I think more people talking about it, more people online, more focus on individual dads and stories. I think can only help. I think organisationally, I think there has been a lot of movement, and I think a lot of professionals are starting to get it. I think some people still need to go on a wee bit of a journey and still need a wee bit of a help and to be a wee bit influenced. But there's lots of organisations working around the UK to try and influence and to try and help people. So I think that it is happening from an organisational point of view. It's really about the money, isn't it? It's about somebody saying this amount of money is available and it's specifically to support dads and therefore the whole family. And once we have a pocket of money, then people can go forward with things. I would only encourage organisations in England. I would only encourage organisations like Leeds Dads to, try and find some of that money and to get some of that money to do something locally. That's not 3 points, I know, sorry, but was it?
Suzanne.
I think communication, lines of communication. So friendships and social connections are really key as far as positive mental health. We know that anyway, but certainly in the transition to fatherhood. So keeping up some of those social connections. I think improved communication for fathers within perinatal health services, not just mental health services, but through conception, pregnancy, labour and birth, and postnatally. So how are you, Dad? Just being mindful that, you know, there are partners, there are dads around, and they might not be physically present, but they're still incredibly important. Clearly funding needs to happen. We need some money put into this. And I think just generally, like, opening everybody's mind to this evolution as far as fatherhood's concerned. It is something relatively, well, I'd say relatively new. That's not really that accurate, but it's something, you know, that dads really want to be involved with their children. Dads really want to be in caring roles and emotionally connected to their children. And there are perhaps a generation, they're lacking a generation of role models, perhaps. So some peer support, some, you know, for dads who don't have, you know, positive role models or any role models, then maybe some peer support.
Right. Was there anything you wanted to add to that, Ron?
Yeah, I could. One that comes to my mind, a really practical, basic one, is exercise and healthy living, trying to live healthy. There's nothing better than sort of going for a good jog or swimming or taking up a sport as a hobby is one way of battling mental health. And I like the idea of the discussions around paternity leave. I think, you know, from yourself, Suzanne, and Thomas, I mean, for me, that's a big one. That's a game changer, I think, in terms of, because an awful lot of difficulties in relationships associated with mental health can begin around the time a child is born, or just before, as it were, or they could be there dormant, you know, in the background before the child is born, or, you know, and then they all come to light when a child is born, you see. And I think paternity leave, coupled with great access for dads to get engaged in counselling by counsellors who can actually engage dads and talk to men, I think is a winner.
Okay, that's great. Thanks very much. Many thanks to everyone for being part of tonight's broadcast with Leeds Dad's AskADad Facebook Live. Our focus tonight was what's up with Dad. In the week of the International Father's Mental Health Day, we asked, are we taking enough care of Dad's mental health? And if not, why aren't they caring for themselves? Why don't dads reach out for help? With me tonight was Suzy Hodgson, a lecturer in children's. I wrote it down on another sheet of paper. It's a lecturer in, Suzy?
In children's nursing at Sheffield Hallam University.
Always better if you do it yourself. And Rob Batiste, a member of Leeds Dads, who's experience in the care and legal field. And Thomas Lynch, founder of Leeds Dads Group, Dads Rock Edinburgh, who probably without his support, Leeds Dads would not exist at all right now. Without his steer, without his guidance, without having a shoulder to complain and whinge and cry on, I would have abandoned this whole crazy idea a long time ago. Maybe probably 6 months after you'd started, I would have just knocked it on the head. But I have to say thank you very much for joining us. And Thomas, you continue to be an inspiration. And Suzy, I hope to have you back on the show again soon. Thanks very much. Just want to say thank you to you all.
Thank you.
Ron?
Yeah.
Oh, hard work, Ron. Knowledge empowers, and even when we find out things about this virus, which might be worrying, as we understand more, the less worried we will be. And don't forget, as well as our AskADad Facebook Live, we have Leeds Dad's Virtual Playhouse. It's on Sunday afternoons at 2 p.m. And Leeds Dad's Quiz Night is on WhatsApp on Sunday nights at 8 p.m. Sounds like a working men's club, it really does. And Leeds Dad's free food parcel service opens on Wednesdays, and it's all here on our website, facebook.com/Leeds Dads. I'm Erroll Murray from Leeds Dads. You can find out more about us by emailing leedsdads@gmail.com, and also find out more about Dad's-tastic Day Online 2020, which is coming up soon. If you go to our website, leedsdads.org, or go to the Facebook page, which is facebook.com/Leeds Dads, you'll find out about the amazing activities we've got coming up for Dad's-tastic Day, all streamed online. And we hope to be back soon. Thank you all very much.
Thank you.
Thank you.
Bye.
Bye-bye.